you bar.
Okay. All right, gang. Well, it's good to see everybody here. I know everybody's busy and now the weather's getting better. Everybody's trying to get out and, like you said, get some exercise, get the kids out, let them get exercise, because I know being cooped up, everybody's just sort of on each other's nerves. So I'm glad to see that the weather has gotten a lot better for everybody. Um, so there's quite a few, well, there's a few slides here, and I've done this for other organizations. So some of these slides I may just touch on and not go completely over or go into a lot of depth unless you have questions. But I just want to do sort of an overview of what the Ohio Grandparent Kinship Coalition is and what we try to do. And if it weren't for you guys, we wouldn't exist. So I want to make sure you understand that we need you backing us up, and we'll back you up as much as we can in terms of helping to get what you guys need. So it's a mutual situation between us and the caregivers, and we want as many people involved as possible. This is a slide, and I have problems doing this slide, so I'm going to skip it. But it's a caregiver story that was done up in Cleveland, and she and her grandson a couple of years ago. They focused on how he came into care, which is because of drugs. Talked about her story, talked about what she's gone through. But I guess the biggest takeaway that I got from her story, and all of you have stories, is that she did it out of love and care and wanting the best for her grandson, and she wasn't going to let him go into um, foster care. So this is why she did it, and I know that's why
Excuse me.
that's why most of you do it also. I've had a hard time showing that, so I'm just going to sort of skip that and not take up a lot of time with that one. The concept of kinship care isn't new, and I'm sure a lot of you that have been doing it for possibly years. I know Pandora has older grandkids, so I know she's been involved with kinship care for years, and I'm sure some of you have for some years. But it's an old tradition. A lot of cultures have always done kinship care. You go back to the African cultures, you go back to even some of the European cultures. There's always been kinship care around, but it's usually for different reasons. Back then it was because it was easier for families to live together, and the generations took care of each other. The older people took care of the younger people, and then as the younger people got older, they took care of their grandparents. So it was sort of a mutual agreement that people that can live with each other. But I think over the years, the last probably 30 years, it's changed some, because what's happened is it's become a separate entity from families, from the big family. It's become another entity on its own, and sort of become its own family when the caregivers become responsible for the children when the parents aren't around. And I think that's the biggest difference right now that we're experiencing, is the caregivers are taking care of their grandchildren like they were their children, because the parents can't be around. So that's a whole different ball game, and there's so many things that come along with that, and I know all of you realize that and have lived it. But a lot of people that aren't aware of it or have not experienced it don't really understand what kinship care is and how it happens. So there are many forms of care. You've got your grandparents, who are the largest population that generally take care of children that when their parents can't. But then you have the other family members, aunts, cousins, even brothers and sisters who might be older, taking care of their siblings. Um, Friends of the family, people that aren't even related. Some people end up with an adoptive situation. So there's a lot of scenarios, but the bottom line is kinship care is the best place for keeping kids out of the system, the foster care system, and achieving permanency and stability in their lives. There's studies that have shown this. And so just to know that what you guys are doing is the best thing for the kids when they aren't able to be with their parents for whatever reason. There are a couple of types of kinship care, and most of you probably realize that you fall in one of these categories. And so, just to touch a little bit on what kinship care is and the types of kinship care. There's the informal type, which a lot of you are in this informal situation where the child has either been placed with you by, say, the parent, or maybe you felt that the child just needed to be taken from the parent because there was the situation, what was going on. The child just needed a more stable place to be. And there's been no court involvement, there's no child welfare agency involvement, and custody isn't an issue. It's not necessary to have that child with you. Where it becomes an issue, though, sometimes is the legal aspect of being able to get things done for the child, like getting the child enrolled in school, getting medical coverage for that child. Sometimes there are barriers there in those systems that make it harder for you as a caregiver to access the services the child needs because you don't have custody. So because of that, probably 15 to 20 years ago, the grandparent power of attorney and the caregiver authorization mechanisms were implemented by the Ohio Department of Job and Family Services. I happened to be working with them at that time in the kinship area, so I was able to work on getting these two legal forms of relationships with grandparents, because right now they only apply to grandparents. They don't apply to other caregivers, which is something that we over the years have tried to change. But the juvenile courts have a funny opinion that if they open it up to other caregivers, people will take advantage of it. For example, a lot of times people try to enroll their kids in different school districts because they want better education or sports or whatever reason. So the courts didn't want to open it up at the time. So I think at some point we want to revisit that and try to get them to understand that there are other caregivers out there that really need this. But the power of attorney is where the parent actually signs off on a form, gets it notarized, and gives the control to the grandparent. It's filed through the juvenile court, and it's generally good for a year. A parent can take it away at any time if they choose to say, well, I want my child back. They can just revoke that. But until that happens, then the grandparent is able to enroll the child in school, get medical assistance for them, do whatever it needs to be taken care of legally. The second one is a caregiver authorization, and that's again specific to grandparents only. And this is when grandparents don't know where the child is. I'm sorry, don't know where the parents are, whether or not they've left town or have just disappeared, don't have any contact with the grandparent or the child, and there's no knowledge of their whereabouts. The grandparent then can fill out the form, have it notarized, and then take it to court again to file with the court. And unless the parent comes back into the picture, it's going to be good. And this allows, again, you to enroll the child in school, get medical help for the child, anything that needs to be done legally. These two forms, if you're ever interested in them or want to use them, are on the Ohio Grandparent Kinship Coalition website, and that'll be at the end of the PowerPoint, the website address, but it's ohiograndparentkinship.org, or you can just Google OGKC and it'll come up. And then you go to the resources section, and those two forms will be there if you ever feel a need to have to use those. The other type of kinship care is the formal arrangement, and that's where either the kinship caregiver files for legal custody, and you go to court, you go through the process of telling the court why you want custody, what the situation is, and the court approves your receipt of custody of the child. And when this happens, it's more of a permanent situation, because what will happen if the parent comes back and wants that child back is that you have to go back into court and they have to prove that they're able to take that child back. So the court has to approve the child going back with the parent once the caregiver gets custody. Um, then there's where the child welfare agency takes the child from the parents. They take the child into custody because of reasons of abuse, neglect, or dependency, and they search for a relative, which that's required for them to do. And if they find an approved relative or an approved caregiver, and they can approve that home, they can place that child with the caregiver. Now, the child or the agency may eventually return the child to the parent if the parent does what they're supposed to do with the case plan, and they can go back with the parent, or the agency can give a petition to court and give custody to the caregiver, and then close the case out. And if they do that, then the caregiver has legal custody of the child. And again, the parent would have to go back into court and convince the court that they are able to take that child back if they want the child back into their home. And then that basically is what happens with a custody situation. The third type of formal placement is a licensed foster parent. And this is when the kinship caregiver decides that they want to become a licensed foster parent. And usually the reasons for that is in order to get foster care maintenance payments, which are generally higher than any of the financial assistance you get if you aren't licensed. So they are required to go through all of the requirements of a foster parent, all of the training, the home study, and anything that foster parents are required to do, they have to do it. Then there's ongoing training that you have to take. So it's a pretty burdensome process to go through. Most caregivers don't want to go through that, so they don't pursue that. But if you do pursue it, and you can become licensed just for the care of the child in your home, the child that you've chosen to care for, then you get a per diem payment for that child until you decide that you don't want to, be licensed anymore. So those are the three types of the kinship care general, or the two types of kinship care, informal and formal. And most of you who are caregivers are in one category or the other and recognize yourselves. Are there any questions, or anybody have any comments?
I do real quick, Miss Barb. This is Latrice. Sure.
Yeah,
I want to say I went through that process.
New, but as far as it becoming something that is recognized more in the agencies and in the courts and with systems, that started back in the late 80s and early 90s. And the reason for that is it was the drug problem back then. Heroin and crack cocaine resulted in a lot of kids being taken out of their homes. The parents couldn't take care of them, and they were coming into the child welfare system. And once the child welfare system recognized that they weren't going to be able to handle all these kids, much like right now, the opioid epidemic, with the opioid crisis, we're seeing more and more kids coming to child welfare, and they can't handle all the kids coming in. So what happened was they started looking at where's the next best place for children to be placed, and what they needed to do to start placing children in those places. So they figured out, and I'm not sure who did or how they figured this out, but I'm sure it came to somebody that was familiar with, well, relatives can care for the children, and hopefully, be able to do a good job until and if they can go home. So they started looking at relatives and kinship care placements. as some place for children to be placed. And so that started back in the early 90s. And in 92, the Ohio Department of Human Services, which today is the Ohio Department of Job and Family Services, they put some money into a kinship preservation program. And if you, a lot of you have met Ron Browder or seen him on the on our meetings. He actually was over that kinship program at the Ohio Department of Human Services. He was in an administrative role, and he supervised that kinship preservation program. It came from some money from the Annie Casey Foundation, who does a lot of work around family programming and supports to families. And so it basically was a cash payment, and then or families could take 6 months of services. For example, if they needed beds or clothing or any kind of other things that they weren't prepared to take that child into their home, then this money could help support that. So that was sort of the start of the state recognizing that if caregivers are going to take children in their home that they weren't prepared for, we need to step up and do something. It wasn't a lot, but at least they started thinking about how they could help caregivers take the children into their homes. And then a few years later, there was the General Assembly, the legislature said to the Department of Aging, they wanted a report on grandparents raising their relative children. And this came about from an effort led by then Representative Barbara Boyd, who is from Cleveland, out of Cleveland, and Joan Lawrence, who eventually headed the Department of Aging. And they got together and recognized that there needed to be some research done to see what was going on with these caregivers and how important it was, and then how they could support them. So they directed Department of Aging to do this report. And so in 1998, the report was done and it was released. And the report came out with about 12 areas that they recognized that were of needs of caregivers at that time, what caregivers needed. And then they came up with a plan of action and the kind of steps that they needed to take to do some of the things that this plan recommended. Now, if any of you know anything about government and money, most everything takes money, and sometimes things don't get done because there's a lack of money or a lack of support. So that's what the next step was that they were facing, is how are they going to support some of these recommendations that were made in this report. And then as a result of that, then in 1999, the Ohio Department of Job and Family Services, they did a shareholders group, and they met with 1,300 people, mostly the caregivers and other agencies, and they came up with their own recommendations to support kinship caregivers. The 5 recommendations they came up with was creating a navigator program, it's an information and referral hotline, a statewide resource guide, a kinship advisory council, and a separate unit within ODJFS for kinship. And then 2019, the Ohio Kinship Navigator Program was created. So that was 21 years ago when the first statewide Kinship Navigator Program was created. As a result, I was working at Job and Family Services at the time. I was in that kinship office where they created it. And so I was responsible for implementing that Navigator program. In addition, we did have the referral line, the call-in number. We developed a statewide resource guide, which is still there at Job and Family Services. You can get it online. It can be ordered through them. The Kinship Advisory Council doesn't exist anymore, but it did exist for a number of years, and it helped guide and direct Job and Family Services on the needs that kinship caregivers had. And so as a result of that, then subsequent to the Navigator program, and which was implemented statewide, It was implemented in 77 of the 88 counties. So 77 counties in the state had kinship navigators. That program was done with $3 billion at the time. So $3 million covered 77 counties' ability to have a kinship navigator to help families find the resources that they needed within their county. And I thought that was a pretty good bang for the buck at the time in terms of how much they ended up spending to really help people. Now, that after that budget, in the next 2 years, it wasn't funded again. That funding went away, unfortunately. But some counties kept their kinship navigator, and even today, there's probably about 5 counties right now that still have that navigator in place and are, still doing the work of helping caregivers find resources that they need. Now I'm showing you this because this is the cover of the report that was done for the General Assembly, the legislators. And the reason I'm showing it to you because the 2 people on the front, Sandy Powers and her granddaughter at the time, so we're talking about over 20 years ago, Tisana. Sandy was one of the handful of caregivers who began the Ohio Grandparent Kinship Coalition. And she was also part of the work group that developed this report that went to the legislators. Sandy ended up taking care of her daughter, or I'm sorry, her granddaughter. Her daughter was involved with drugs, couldn't take care of the granddaughter. She wasn't able to give her the proper care that she needed. So Sandy, and then, whoops, sorry. The next slide shows Sandy, Tisana, and Sandy's husband, Don, Tisana's grandfather. They took into Tisana, and eventually they ended up adopting Tisana because her grandfather, Don, came down with, he had cancer, and before he died, they decided in order for Tisana to get his benefits, his survivor's benefits, the Social Security benefits, they had to adopt her. So they decided that that was the best thing to do, to adopt her and make her legally their child. So they did that, and now Tisana is grown. She has, I believe, a couple of children. Sandy's, a grandmother, actually great grandmother, and they've just gotten along great. And Sandy's been a great help over the time, helping guide us and help us along with the coalition. She's not as actively involved as she had been, but she was one of the founders of the Ohio Grandparent Coalition, and it's it's been maintained, and hopefully doing the things that it was set up to do. And the big part of our organization is to advocate and make sure that caregivers are getting what they need, and people know about what caregivers need. So this is a little bit about the Navigator program. I was telling you that how much it costs, and the counties down here that still have them: Lorain County, Lucas County, Richland County, Muskingum, Franklin County here. The Clintonville Resource Center does some Navigator functions, and then Sandy Bryant, who is now the Navigator for Ohio Kinship and Adoption in Montgomery County. She's, I think she might be on the call, but her organization at Children's Hospital, they became the Navigator for the Montgomery County area, and then with the new program. Any questions, any comments?
Actually, they still have, this is Sandy Bryant, they still have the county navigator program too going. So we have
good.
both. Yeah.
Oh, that's great. That's good to
Yeah.
know. Great. Thanks,
Thank you.
Sandy.
Thanks.
Okay, well, just to let you know a little bit about the kind of advocacy that the Ohio Grandparent Kinship Coalition does, and we can only advocate with the help of the caregivers. One voice, one person going and talking to a legislator or sending a message or making a phone call doesn't have much of an impact. But when you have hundreds and maybe even thousands of people talking to legislators, talking to the heads of department, talking to the government, talking to your elected officials, then that makes an impact. So OGKC is just a vehicle for getting some things done, but we need the people to be involved in that vehicle, be driving the vehicle in order to get those things done, because it can't be done just by one person. So most of the advocacy we've done is with the help of caregivers. We've had, some of you may have been part of these. We've had rallies on the State House. We've had legislative action days where we actually gone into talking to legislators. We've had our conferences. Some of you may have been able to come to the conference before COVID. We've had in-person meetings before COVID. We would meet every 3 months. Now I think some of you have attended our Zoom meetings where we try to have something every couple of months to keep people engaged, keep people involved, to update you on what's going on. And when you need the support of the caregivers, then obviously we're going to let you know what we need done. So this, for example, federal legislation, we've been involved with our federal legislators on helping get federal legislation passed that helps support caregivers. This Family First and Prevention Services Act came about in 2018, and it looks at what families need to stay together and how the federal government can support families and ensuring that they get what they need. Parents, relatives, those people that are the support of families, make sure that they get what they need to prevent kids from coming into care. And so it covers a lot of issues, a lot of areas, mental health, the kinship foster home barriers, encouraging kinship navigator programs, family engagement with families and children that have to be taken out of their homes. So there's a lot that has gone into that Family First Prevention Services Act, but we made sure that there was some kinship supports in there also.
I have to say,
Yep, go
I
ahead.
read about this
Angela.
online and I had forgotten that you guys were a part of this. And it's so cool because it is like such a nationwide impact and just getting attention to the issue on a national level. So it's so cool that you guys were a part of that. And it really is a big deal.
Yeah, it is a big deal. I think it's probably the first time that the federal government recognized the importance of kinship care and supporting the caregivers. So it is a big deal. And the Ohio Department of Job and Family Services is implementing it at the state level, and they've created a series of work groups. And actually, Dr. Ollie Jones, who is our current president, serves on the work group here in the state level to talk about the kinship issues. So we're still involved in that. We're still making sure that whatever's out there, whatever supports are out there, they come to Ohio too, that Ohio gets what they need for our caregivers. So it is an important piece of legislation. The Family First Transition and Support Act of 2019, that's sort of a support to the original 2018 federal legislation, and it was introduced by Senator Sherrod Brown, who is our senator here in Ohio, and then Senator Debbie Stabenow, who is from Michigan. But what this act did is to provide the resources and the funding to help with the Family First. A lot of times you'll have legislation, but you don't have the money to come to make sure the implementation of the legislation happens. And this is what Senator Brown made sure. And we work very closely with Senator Brown. He's helped us out a lot. He's come to our meetings. He has come to the conference, and then he did speak at one of our Zoom meetings a couple of months ago. And he's very interested in kinship care. He's very interested and concerned about kinship caregivers. So he's been a real support to us in Ohio. And anytime that you have to support him, I would reach out and do so. So the funding helps the states put into effect some of the programs that have been identified that families need, like the child care, transportation, things that family needs to keep children in their homes. And then we also try to work with our state legislators, because that's where a lot of the federal money that comes into our state needs to be directed into what's needed at the local levels. So we try to work with our state legislators to make sure that they recognize the needs that kinship caregivers have. And the state legislation, we have a 2-year budget, and so the previous, the budget that we're under right now, which is going to end this on July 1st, we're under this budget right now. That was the 2020 and 21 state budget. They had some funding out there for kids who are in different systems, like with the juvenile justice system, the mental health system. They crossed over, and they wanted some funding to help these kids who had to be in these systems, to help support them and get them out of these systems and get them the appropriate help they need. In that budget also, there was $8.5 million for each year, so it comes out to $17 million to support the Kinship Navigator program, the current Kinship Adoption Navigator program. And so that funding is now supporting the Kinship Navigators that have started being placed in some of the counties. Like Sandy said, she's in the Montgomery County area. Right now, I think there's only 29 navigators that are up and running. It's only been happening for about a year, so they're planning on rolling it out, and hopefully at some point we'll get 100 navigators throughout the state helping kinship families. So this is what that pot of money at the state level is helping to support. The Kinship Navigator program came out of a result of Representative Janine Boyd and Representative Baldridge. And if you remember, when I first started talking about the implementation of the Kinship Navigator program back in 2000, Representative Barbara Boyd was the originator, along with the Department of Aging. And that her daughter now has taken up, Representative Boyd has retired, but her daughter has taken up her cause, and she is now involved in supporting kinship care. And so right now we work closely with Representative Boyd to make sure that things are being introduced to support the caregivers. And the Kinship Navigator program was part of her legislation to implement the Ohio Kinship Adoption Navigator program. And she also expanded the definition of kinship caregiver in law to include any non-relative adult the child identifies with and has a long-standing relationship. So it's just not blood relatives, but now that definition has been expanded to the non-relatives, which is a big deal, and is going to be very helpful down the road. This past December, Governor DeWine signed off on a program that is the Kinship Support Program. It's part of this General Assembly, the legislature this year. And I think we might have touched on this, but maybe not in a whole lot of detail. But what this program is doing, and it's been implemented, and it's retroactive back to December of 2020. It gives monthly payments to eligible kinship caregivers for the placement of children in their homes. It's for those families who aren't certified as a foster parent, a foster caregiver, and the child is currently in the legal custody of Children's Services. It's a time-limited program. There's you can receive it for 9 months or 6 months, depending on if the child was already with you or the child comes into care after the program became effective. And once the money stops, and the payment is $10.20 a day, which is a little over $300 a month. What the intent of this is to help caregivers decide whether or not they want to become licensed foster parents. And so between the 9 months or the 6 months that you're getting this money, the caregiver is making a decision on whether they want to go forward and become licensed and then get licensed and get the per diem foster care payment. If you are qualified for this program, you can't receive both the Kinship services or support program payment and the child only payment. So you receive one or the other. And basically, this program is meant to meet the requirements of the GLSEN lawsuit that I think we've talked about before, and I'll talk a little bit more about it when I get to it in a couple of slides, but it's really supposed to meet those requirements, and it falls short. And OGKC has, made their position known that this doesn't meet the requirements of GLSEN, and so we've had some conversations around this with some other organizations that we plan on making the governor aware and our legislators aware that this does not meet those requirements, and really wanted to look at this again. So it's out there. I think there's some issues with it. I know some, caregivers may have some issues with it, but it's just not the best way to go in terms of how we want to support caregivers right now. Does anybody have any questions about it or anything else? Okay. Now for this coming budget, for the next 2 years, the governor has made some proposals. This budget will go into effect on July 1st. Every new budget has to become effective July 1st of that first budget year, the biennium. So our current budget ends June 30th, and then the next 2-year budget begins on July 1st. So in this budget, they've maintained the financial support for the Ohio Kinship and Adoption Navigator Program at the same level, $17 million for both years. 30 Days to Family, which is another tool that county agencies can use to find kinship caregivers. There's funding for that in this budget to keep that going. The Kinship Permanency Incentive Program, which is through the Children's Services agencies, and it is an income-based program for families who get custody of kids coming through Children's Services. That's still being funded, so that's going to be around for those families. Then some new programs that they're talking about trying to implement with some financial support. There's the Kinship Guardian Assistance Program. Again, it's a program for families who are taking custody of the child, but the child has had to have been in foster care for 6 months before this happened. So there's some eligibility requirements that all families may not meet. And so it's not for everybody. It's not for the informal families. It's going to be for formal situations where the child has been in foster care. The Kinship Support Program is what I just talked about. That's the money that's allocated for those families who are thinking about becoming foster parents. Then new policies is potentially establish a Kinship Guardian Assistance Program with the money that's being allocated. Again, it's going to only serve a small population of caregivers. It's not going to serve everybody. And there's a legislator who is looking at implementing a Resource Family Bill of Rights. And this Bill of Rights is something that is going to give foster parents, adoptive parents, biological parents, kinship caregivers, some in terms of what their rights are in their different roles. And I haven't seen, I really haven't seen this bill yet. I think it's in, they're creating it and crafting it, so it hasn't come out now. When we do get it, I'll definitely share it with Angela and everybody on my email list to be able to let them look at it and, give your 2 cents, because you have a right to give your 2 cents on things that are going to affect you. The bad news is in this budget, the Kinship Caregiver Program that was funded in the last two budget years has been eliminated. That was a program that was in the Department of Job and Family Services that used some of their TANF monies to do things like provide maybe maybe beds or clothing, maybe provide some respite care, some child care services, those kinds of things. And so I think some of that money went to the other program, the Kinship Support Program, but whatever the reason was, they took that $15 million out. And the bad thing about this program being eliminated is it's served a lot more families than the other program that's coming into place, the Kinship Support Program. So I don't know that it was the best thing to do. And we've had some talks about this among some of the agencies and organizations that are, wanting to talk with the legislators. So that's not the best thing to have happened in this upcoming budget. Okay, to sort of maybe just do an overview for people that don't know about the Glisson lawsuit that happened a few years ago. This was a lawsuit that was filed in Kentucky, and what it said was that if relatives or kinship caregivers have been approved by the state agency that is authorized to approve placements, then they are eligible to receive the same amount of money that licensed foster parents receive. And because the state wasn't doing that, then there was a lawsuit filed in the Sixth Circuit Court of Appeals, which includes Ohio. There's, I think, 5 states, Kentucky, Ohio, Michigan, and a couple of others that are part of that Sixth Circuit. And so when this appeal court approve this, then it's up to the states to implement it. Part of the problem here is that Ohio has chosen right now not to implement it. And again, what they've tried to do is take that kinship support program and say that this is what meets the requirements here. And if you see what the requirements are on the Glisson lawsuit and compare it to the kinship support program, it really doesn't meet those requirements. It's more restrictive. So as a result of that, in 2020, the attorney that worked on the lawsuit in Kentucky took on the cause in Ohio, and he was able to file a lawsuit against the governor on behalf of the eligible kinship caregivers in Ohio that says that they're violating federal law and they're not providing kinship foster parents with the same foster care maintenance payments that they're entitled to. There was a hearing on December 3rd of last year in the courts, and right now I think they're just waiting for the courts to come back and say what the next step is. So whenever that happened, and I know there's some caregivers that I reached out to that became part of the lawsuit. Is anybody on the call that joined the lawsuit? Probably not. Some of them were in other counties, but there are, I think, maybe about 5 or 6 caregivers that are part of this lawsuit that's moving forward. And hopefully, as a result of the lawsuit, then Ohio will have to implement the foster care maintenance payments for those caregivers who qualify. Not everybody's going to qualify. The informal families, which make up the bulk of the caregivers, will not qualify for the payments, but those who do then will be eligible to get the same payments that foster families get. And as a result of my work and OGKC's work over the years of working with caregivers, these are some of the areas that we've recognized that caregivers really need support for. And I know all of you live it and you know it, and I'm preaching to the choir, but just to know this, that when I present this to other organizations that don't know, this is what I let them know, that this is what caregivers need in order to be successful with the children in their care. And these needs are the things that we advocate for when we have the opportunity to make sure that legislators know that these are the things that caregivers need to maintain the children in their family. Otherwise, they'd be in the child welfare system. They'd be costing us so much more money that we wouldn't, the system couldn't handle it. So, you know, you need to step up to the plate and do what you need to do to help these families keep those children out of the system and do what's best for them. These are just some kinship facts that are sort of old, but they're the most current that I can find right now. I think they're being updated, but it shows you just how big kinship is nationally. Over 7 million children are in kinship care. Then, you know, how many grandparents? Basically, census data only captures grandparents. They don't capture the other caregivers. So we really just have the grandparent data. But you can see that, you know, over 200,000 kids in Ohio are in a caregiver with grandparents with no parent. And, you know, then there's the over 200,000 or the caregivers are, you know, represented here with the grandparent headed households. What's going on with the grandparents? They're working grandparents. They're not just all sitting at home. They have to work. 22% of them are in poverty. They have disabilities. They're single families. They are brown in Latino, in African American families. So, you know, it's a representation of our population, and people need to recognize that this is a growing situation, and that there needs to be more supports, because if you look at the data, you can see that it's affecting a lot of families, and not just grandparent families, but other families that have stepped up to the plate. These are just some sources where gotten some information that are very good for resources if you're looking for just information in general. Obviously, our website is on there. Angela's website is on there. Grand Families, Generations United, the GU.org. Then there's benefits for the financial and medical assistance. So, you know, these are some of the resources out there for caregivers. And this is to me, this is my most important piece of information and slide that I added here for you guys, especially. You as individuals and as a collective group have the power to make a difference. I want you to know that you don't have to depend on OGKC to speak up for you. You have the power to make a difference with your legislators, whether they're state legislators or federal elected officials. Because what a lot of people don't realize and don't think about is they work for you. It's our tax dollars that pay. A lot of times they act like, I don't know what, they act like we work for them. But they work for us. Our tax dollars are paying for them to be in doing that job, and we want them to do that job. But in order for them to do that job, it's the squeaky wheel that gets the grease. So you've got to start being the squeaky wheel. And what makes that wheel squeaky is when you start telling your story and you let them know that you are their constituent, whether you voted for them or not, your tax dollars are paying for them, and you ask for what you need when you have the opportunity to speak with it. I'm going to tell you how you can do that. In order to contact your state representatives or your senators, you can go to this website, and Angela has the PowerPoint, so she'll be able to get this information to you. You search, there's a search box, you put your address in or your zip code, your senator and your representative will pop up automatically. And you can click on their site there. It goes to a website where it links you to their phone number and email information. So you have then the ability to call your office or call their office. You can request to speak to the legislator themselves. And a lot of times who you're going to get as an aide, the legislator may not be present or be able to talk, So you talk to the aide because they're responsible for communicating with their legislator. So you speak to the aide, you tell them your story, you tell them what you need, and then they're responsible for passing that on to the legislator, and they should get back to you with a response. And I've done this, and I've gotten responses back. They're obligated to let us know that they are listening to us. Then you can also complete an email form if you're not able to speak, or even if you speak, you can complete an email form detailing the same thing. If you don't want to talk on the phone, that's fine. Fill out the email form and let them know who you are and your story. Let them know you're their constituent, because that makes a difference. They need to know that you're a possible voter and that they need your vote. So let them know that you live in their district and these are the things that are of concern to you. If possible, and I know COVID probably has impacted this, but if it's at all possible, you could request to meet with them, and they're in their home offices. Normally they're here in Columbus at the State House in their offices part of the year, but they come home for breaks. They come home for a summer break, and then over the holidays they're back home. And during that time, they're there to meet with people and talk with people. So I would call if you want an in-person meeting with them, which makes a big impact. Call and ask when's the next time the representative or the senator is going to be in town. Could you set up a meeting with them if they're having in-person meetings? They may not be right now, but it doesn't hurt to try. And then your federal official, I mentioned Senator Brown, and then each one of us has a representative at the federal level. So go to this website and you can do the same thing. Let them know at the federal level the kinds of needs that you have, what your story is, and the things that you want them to do for you, because you are your best advocate. And I've been to legislative hearings where there's been a whole bunch of agency people there telling the legislators what they, what the people they represent need. I've also been to them where they've had groups of people actually living the situation. They get up, they tell their story. It's a powerful way to get the senator or representative's attention. And then after you tell your story, then you tell them, and this is what I need to make my life or the lives of people around me better. And that's really powerful. What a group of us organizations are planning, and hopefully we'll be able to do it probably in the first part of May, since the budget is going to be voted on in June. We're going to set up a date for a legislative action day. And what we'll do is we'll give people the date, let you know when the date is, give you some talking points so you know some of the things that are being considered. We'll give people talking points, and then we're going to have you set up either call in or email on that one day. And that's a really powerful impactful way to get your legislators' attention. When they see that hundreds of people are calling in, then they really pay attention to that. So when that information comes out, I'll make sure that Angela knows it. Again, if you have not gotten emails from me about upcoming events for OGKC, you can email me at my email, so I can put you on the Ohio Grandparent Kinship Coalition email list. And that way, when we have things coming up through the OGKC, then I'll let you know when our meetings are coming up, or with any other event that's coming up. So, but if you're on my email list, you already get that information, so you don't need to do that. But please, just if nothing else, if we set this date up and we really want to have people involved, we hope that everybody that can will be involved and make sure that your voice is heard. So are there any questions or